Morning, everyone. My name is Do-hyun Lee at Research Laboratory of Electronics MIT, and today I'll introduce the Dash-funded support project, which covers the developing a point-of-care integrated microfluidic platform for sepsis monitoring. The project is advised under Dr. Joel Boltzmann. Sepsis is a clinical syndrome characterized by systemic inflammation that arises from a serious bloodstream infection. Sepsis has a high healthcare burden for nearly 24 billion in annual cost and is the most expensive condition to treat in US healthcare system. Also, it is the 11th highest cause of the death in the US and has 18 million sepsis diagnosis cases, with the incidence of this condition increasing by 10% annually. Clinical studies show that the mortality is significantly reduced if sepsis patients are identified and treated at early stages of the disease process. The key element in treating severe sepsis include early antibiotics, early recognition and intervention, source control, and hemodynamic support. Also, sepsis is a fast-moving disease as a clinical emergency where patient state can change substantially in a matter of hours. Therefore, clinical monitoring with frequent assessment is the most important among severe sepsis patients to reduce the mortality. So after diagnosis, sepsis patients are commonly monitored by clinical criteria, vital signs, and peripheral blood glucose counts. Based on the monitoring results, then we can expect to the potentially better titrate medication therapy, which leads to reduced lengthy treatment and healthcare costs. Okay, we are assuming that you are already in the intensive care unit, which is ICU. You will do the CBC, which is complete blood cell count, and this provides a census of the immune cells from your blood. And this is a super important assay, but it requires lots of blood draw over 3 milliliters, several hours for sample preparation and isolation. And it doesn't tell you what the cells are doing, and it doesn't tell you the function of the immune cells. Also, the whole process is manual and labor intensive, as well as a rapid sampling for the CBC can lead to blood loss. Among the type of white blood cells, here we are looking at the neutrophils that help heal damaged tissues and resolve the infections. So neutrophil blood levels increase naturally in response to infections, injuries, and other types of stress. Also, bacteria allows the neutrophils to become activated during sepsis. That's why we are focusing the level of activated neutrophils versus non-activated one. So we have a straightforward pipeline that to have patient take a very small amount of blood and take the white blood cells out at the first stage and profile the white cells using the small microfluidic device with electronics that will be described at the next slide. So we have a microfluidic device in here. The cells are coming in the one side, and they enter this device and encounter these electrodes here, and the electrodes energize the small voltage that creates the little electrical force in the cells, which push them across the channel. So the activated and non-activated neutrophils can be deflected and differentiated to each lateral position in the microfluidic channel, and the results end up the distribution of the cells like this histogram. So again, the platform needs only 50 microliters of whole blood and 25 minutes assay time. And we have done the pilot study at the Brigham and Women's Hospital. And as a result, the point is that if you look at the number of different samples across healthy and sepsis patients, you get a slight separation between two states. When you look at the correlation between the total amount of neutrophils by CBC and the clinical score called SOFA, 0 is healthier and 20 is very sick, you can see a quite spread, but when we took this data in terms of the microfluidics has a best correlation to the clinical score. So we are pretty excited about that. It has potential value as clinical indicator of the immune system. As support from MIT Dash-funded Center, we would like to provide a fully automated sepsis monitoring solution which can be reliably run by ICUs, clinics, and hospital labs to improve sepsis care. We are now working on reduction time to 15 minutes assay time, lower the sample volume below 50 microliters, which can translate from blood draw to finger stick, increase the sensitivity and specificity, lower the test cost, and developing the user-friendly system to enable bedside assessment. While we focus on here on sepsis as a well-defined and clinically important use case, our system has applicability beyond sepsis, such as pediatric immune disease, coronavirus, and autoimmune diseases, and so on. In the current coronavirus crisis, Real-time immune monitoring using IDS could also be useful for adjusting treatment in coronavirus-infected patients. Also, treatment of chronic autoimmune disorders such as rheumatoid arthritis could be placed at the patient home for routine monitoring of disease. Thank you so much today, and I hope we have a great discussion during the network session. And please reach out me and Dr. Joel Boltman if you have any questions and comments on this project. And I'd like to thank you, our collaborators at Brigham and MIT and the MIT Deaf Center. Thank you.